Hello again. We are here with Dr. Ian Lusbader that's going to enlighten us about everything that has to do with calcium score testing. And I know everybody's heard about this, and we have some questions. I mean, what is it about? And hello again, Dr. Ian.
Hi. Calcium scores. As part of general medicine, internal medicine, and cardiology, we like to hopefully be proactive, try to reduce the incidence of stroke and heart disease. And one element of that is cholesterol, family history. There are a lot of risk factors for heart disease. We try and get a good history. Certainly things like smoking and family history are very high on the list. People have other family history of heart disease, things like hypertrophic cardiomyopathy and valvular disease and aortic aneurysms. Aortic aneurysms have been in the news lately, but the calcium score. So over the past, I would say 5 to 10 years, but really even going back further than that, we were able to measure calcium via a CAT scan in the coronary arteries.
You mean like the deposits in the blood vessels?
Right, what we would call
That's
plaque.
Okay. Plaque.
And part of the understanding, or part of the risk factors of heart disease, is plaque in the arteries that feed the heart muscle. When those arteries get obstructed, you have a heart attack. Sometimes it's called ischemia.
So it's like piping. It's like piping that is getting too tight because of these deposits. Okay.
There are usually three main arteries that feed the heart muscle that come off of the aorta. So the heart is a pump, and it pumps blood out to the rest of the body, but it also pumps blood to itself. And over time, depending again on family history, blood pressure, cholesterol, a whole host of factors, those arteries can develop plaque, which often is soft plaque, cholesterol deposits. We won't go into the whole physiology of it, but often high levels of cholesterol can deposit in arteries, create inflammation. That inflammation, cytokines draw in other cells that further inflammation. And one of the responses of the artery, the lining of the artery, unfortunately, is to become damaged and to get deposits of cholesterol.
Even the soft deposits are dangerous because there's difference. There's the soft and the hard, and define what's the relevancy between the soft and the hard deposits.
So over time, those soft deposits usually can develop calcium and then get more fixed, and then over time narrowed. Part of the problem again is when you get calcium in those arteries, they're less compliant, it's less soft. Instead of a garden hose maybe that accommodates water flow or blood flow, it can't get through. Becomes more like a pipe that develops narrower and narrower, and eventually a clot can form in there, like your drain pipe. Suddenly the sink backs up.
So when the doctors end up finding a higher level of all this plaque, then they can go in there and clean it up? Is that what you're saying? The soft and the hard, they can clean it up?
Well, hard plaque is very hard to clean out. There are a variety of approaches. Initially, we try and give statins, things like Lipitor, atorvastatin.
Let's talk about statins.
Right, and some people, can have side effects from that, and statins don't work perfectly. Some well-known studies see that statins reduce stroke and heart attack. Somewhere in the 30, 40%, 50%, we can tweak it higher with other medications that affect the absorption of cholesterol, things like ezetimibe, low-dose aspirin. There are a variety of things that can help, and we have new drugs that actually affect the LDL or the bad cholesterol. So when someone comes into the doctor and they're worried about their cholesterol or worried about the risk of heart disease, one of the things we do certainly is to get a blood test. What is your cholesterol? What are the components? High density or good cholesterol, total cholesterol, triglycerides, and other fatty substance. LDL, bad cholesterol.
So every doctor does this, or just cardiologists? I mean, if the doctor comes in...
Well, generally the internist should be able to do this.
And who recommends, so a patient comes in, and I've heard of calcium scores, but lots of people haven't heard of calcium score tests, and the doctor has never told them about it. And I know, when I see a patient in my office that they'll come in and I'll tell them, make sure you get a calcium score test. What is that? My doctor never told me about that. And Who do they
Well,
ask?
there's always a variety of delay in sort of what is acceptable medical practice. They're really much more widely available. Most medical centers do it. Even private radiologists will do
And
it.
it's a simple test.
It's it's a 15-minute test.
15
You
minutes.
go into a CAT scan. Of course, some people are afraid of CAT scans, but it's very low dose. You're in and out. We often find incidental other findings like little lung nodules because you are imaging that part of the chest. So you're looking at the heart. Incidental lung nodules can also be found. That's another discussion. But if someone has a 0 calcium score, they may have some plaque, they may have soft plaque, but it correlates to a very low risk of heart attack.
An immediate heart attack.
An immediate, right, within X amount of time. You know, obviously any test is valid for a certain amount of time. You know, you can't say 5 years from now it's still 0.
You have to repeat these calcium score tests, and I know many patients that come in and I personally think that because they have heard of a calcium score test, they are alive today. I heard of it from other people, so I passed it on. But I have to tell you that they come back, and all of a sudden the doctor gets shocked. Oh my God, a very high incident, very high index there. So you have to go repeat it, and then
it's variable. We do see some people with very high, in the thousands, and when you do a stress test or even an angiogram, they have calcium in the wall of the artery. But most of the vessels are clear and patent. And you can have people...
How accurate are they, though? How accurate are these calcium score tests?
Well, the calcium scores gives you a number. You have to do further testing.
Yeah.
And you certainly, it's one way to motivate people who may not have ideal ratios of cholesterol to get tested and treated. Now, we do have people with high LDLs, for example. You think it's a risk factor. Their calcium score is 0. And then, you have to motivate them. So it's important to ask your doctor, should I have the screening test? What do I do if it's high, medium, or low? It's a discussion. As all testing with patients, it's more information. How do you use the information?
I love it. Thank you for explaining calcium score testing. We'll see you next time.
See you next time.